Good morning, everyone. Good morning, everyone. Thank you for joining us today to talk about the OASAS strategic plan. I'm Chinaza Cunningham, the Commissioner of OASAS, and I'm joined by Andrew Heck, who's an Associate Commissioner of our Prime division, which of course now I can't remember what it stands for, but it's about information and data gathering. And Andrew's been very instrumental in helping us develop the strategic plan and in working with all the local government units on their strategic plans. And so we are both here today to sort of walk you all through where we are with our strategic plan and to get feedback. So here are some of the ground rules today. So this town hall presentation is being recorded and will be available on the OASAS webpage. All of your lines have been muted, and so please use the chat function to share comments and questions. We will definitely have time to go through the chat. However, I also just really want to strongly encourage everybody to visit our strategic plan webpage. We're going to give you the QR code. And because we have a survey to be able to capture your comments and questions in writing, and we're really getting feedback from a variety of providers and OASAS staff. So we want to be able to put all of that together to refine and update our strategic plan. And so at the end of today's town hall, when you close out the WebEx, you will be directed to that webpage, which has the strategic plan draft on it, and also an opportunity to provide feedback. So again, we're looking for feedback. Would love for you to use the web page to do that, so that it's in a survey that we are then, putting all the survey results to help us refine our strategic plan. So again, thank you for joining. So this is what the web page looks like that you will be directed to. So on the strategic plan website, you can click on review the draft plan, and then you can also click on the provide input data. So you'll have the full draft plan there available, and definitely hoping that you will provide input using this method. So I just want to start off by giving some background about the strategic plan process. So we have a 5-year statewide comprehensive plan that both sets internal and external priorities, goals, and strategies. And this is actually required by law, by mental hygiene law, so every 5 years. We also are required and, of course, want to get public feedback. And that certainly helps us align our priorities with those who are impacted by addiction, so providers and people with lived experience, and local government units and families. So we're really looking forward to getting your feedback. So this is our timeline, sort of where we are thus far. And this has been a process that we have really put a lot of time and thought in at OASAS. And so we had our first planning session in November of 2022. The executive team at OASAS met many, many times, had sort of, half-day meetings to really think about what we're doing and what we are doing, what we should be doing, what we aspire to be doing. And then in, really looking at our goals and objectives, we completed this at the end of 2023. We then revised our mission and vision statements around the same time, and then developed sort of further details and completed our draft plan, which was released in May of this year. And so now we're here we received sort of feedback from the OASAS staff, and now are getting feedback from you all for the public feedback. Then we plan to submit the final version of the strategic plan in November of this year. So again, we're on a 5-year cycle here, which is required by mental hygiene law. So our revised mission and vision statements are as follows. So the mission of the New York State Office of Addiction Services and Supports is to provide, support, and oversee a data-driven continuum of addiction services delivered with equity, dignity, compassion, and respect. And our vision statement is that OASAS envisions that people in New York impacted by addiction will thrive and lead healthy lives. So I think many of you have heard me talk about our guiding principles, which are really embracing harm reduction, using a data-driven and evidence-based approach, and then using an equity lens in everything that we do. And so these principles have really helped to inform our priority outcomes. And so when we think about the priority outcomes, we really focus on the people who we serve, really as the, obviously the core of what we do, and those outcomes. We think about the addiction services system infrastructure and making ourselves accountable, and then also really supporting and enhancing the workforce. We think about the reputation, the relationships, and the outreach that we do with providers and communities. And then more internally, we also think about the infrastructure and processes that we have at OASAS, and so how we conduct business to make sure that we're efficient and effective. And then finally, looking at our staffing, our leadership, and our agency culture. And so this strategic plan is organized by these sort of pillars, is the way that we think about. Next slide. So to start with, for our priority outcome number 1 is people served and service outcomes. And so our priority here is to have a continuum of services that remedies systemic racism and is accessible, desirable, and effective. And within that priority, we have the following 4 goals. To develop a service continuum that matches individual, family, and community needs. To ensure that services are desired, valued, and utilized. To optimize outcomes across the continuum of services. And then to reduce racism and stigma surrounding addiction. So again, this is the first priority outcome around people served and service outcomes, and you can see really the objective and then the goals to meet that objective, and that's how our strategic plan is organized. So we'll walk through the next priority outcomes as well. So priority outcome 2 is addiction services system infrastructure, accountability, and workforce. And so our objective is to have an addiction services system that is accountable for achieving optimal outcomes with and among providers and people served. So really working with providers and people we're serving to make sure that we're achieving optimal outcomes and that we are accountable. The goals here are to promote mutually respectful engagement, transparency, and accountability with providers and the people we serve, to increase the number, diversity, and engagement of the addiction workforce, to leverage finances to optimize our outcomes, and then to improve monitoring and accountability of services provided under and within OASAS oversight. So again, this is focusing on the system infrastructure, accountability, and the workforce. Priority outcome 3 is the OASAS reputation, our relationships, and our outreach. And so the objective here is to be recognized as the definitive leader on addiction in New York and serve as a model for others. And so part of these goals are to be the acknowledged experts on addiction, to enhance strong collaborative relationships with external government stakeholders, and to promote the success and value of OASAS, the addiction services system, and the people that we serve. Again, so this is priority outcome 3, focusing on OASAS reputations, relationships, and outreach. So now these next set are a little bit more internal to OASAS, so the OASAS infrastructure and processes. And the objective here is to have an efficient and effective agency infrastructure and processes to improve our operations. And so the goals here to meet that objective are to refine our data collection to reflect the service continuum and to inform policy and decision making, to automate, standardize, and improve our processes, and to modernize our agency physical infrastructure. And that's particularly relevant for our addiction treatment centers. And then the fifth and final priority outcome is focused on the OASAS staff, leadership, and agency culture. So again, this is more internal. And the objective here is to be an agency, to have an agency culture where people are engaged in the mission and feel valued. And to achieve that objective, we have 2 goals, which are to create a recruitment process that's aligned with the OASAS priorities, and then also to foster an environment that is anti-racist and supports learning, engagement, and professional development. So I know that that is kind of a quick run through, but I want to say that this is all available again on the website. So you can see the QR code here where you can review the draft plan in its entirety. And again, we definitely want for you to provide input. Again, happy to, I know I've seen some things in the chat already, to take your comments or questions here today. And then also strongly encourage you to provide written input as well on our webpage. And again, this QR code will bring you directly both to the draft plan and to the place where you can provide input. And so again, this is a depiction on the left of these pillars. So at the core are people that we serve and the service outcomes, and then the addiction services infrastructure and workforce, then our reputation and relationship and outreach with programs and other government units, then our infrastructure and processes, and then finally our staff, our leadership, and our agency culture. And so this is a quote from me about addiction being a chronic disease that we know impacts many New Yorkers, and that we know we're losing far too many people to overdose. And this plan is really a way to map out our strategies to ensure that we have life-saving services that are accessible to all New Yorkers. And clearly, a huge part of that is working with all of you. So I am happy, myself and Andrew, we're happy to take questions or comments in the chat about anything of the strategic plan. And I know this is a huge topic, and I know it's hard to write, very, very specific questions in the chat. but certainly happy to have more of a discussion if there are questions or just comments. And again, we are collecting all of this information through a survey online. And so please, 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 you can take a lot more time there and put in your comments and questions. And I want to say that the survey will be opened through August 31st. Is that right, Andrew? Yes. Okay. So you have over a month. So you have plenty of time to read the strategic plan and to think about it more and to put in any of your comments into the survey. So with that, let me take a look at what we have in the chat. Okay. So the first question is, are you able to speak to any potential OASAS OMH integration in terms of regs or joint agency audits? Yes, absolutely. So I think, when I think about the strategic plan, this is absolutely about meeting the needs of individuals, with addiction, family members, and community. And we know that there's a growing number of people with addiction have a co-occurring mental health, condition. We have certainly looked at our data across New York State to look at what that intersection is and also across the country. And what we do know is about 2/3 of people who have Medicaid in New York State who have addiction also have a mental health condition. Most common is depression and anxiety. It's a much smaller percent of people who have severe mental illness. But we also know that percent is growing. And so we know that there's clearly a need to be able to address co-occurring disorders. And so with that, we work very closely with OMH on a very regular basis, both at I work with Commissioner Sullivan a lot, and the staff work together a lot to really constantly ask the question about how we can do better to meet the needs of people with co-occurring disorders. So we are looking at our regulations. So let me just say this. In terms of doing better, I think there's a lot of ways to think about that. Part of that is regulatory approach, right? Part of that is thinking about reimbursement. Part of that is thinking about new models. Part of that is thinking about how we fund programs, right? And so we are looking at all of those ways. And so just as an examples, we're looking at the licensing and we will shortly be coming out with a new approach. And so this is something we're really working on closely with OMH to really think about how OASAS programs can offer more mental health services and OMH programs can offer more addiction services, and how to do that within the context of our existing regulations and thinking about how reimbursement can then reflect that. We'll also have, more and more programs, different models like the tripling of CCBHCs, like the crisis stabilization centers, right? That really are staffed to both address mental health and substance use issues. With a lot of the new initiatives, we are making sure that we're incorporating from the beginning people with co-occurring disorders. So I know OMH is doing this, with their $1 billion in terms of housing, in terms of school-based services. And so that's also, the kind of work that we're doing. In terms of even, for example, how we finance programs, we heard also loud and clear from the Opioid Settlement Fund Advisory Board that co-occurring disorders is sort of an overarching theme. So we changed the way in terms of how we put out RFAs, and part of the scoring now includes ensuring that programs are addressing mental health concerns, and so people get the applications get points for that. So really, we're in a variety of ways really trying to incorporate better on how we can better address what we know is a growing, phenomenon of people with having co-occurring disorders and so substance use and mental health disorders. So I know that's a long answer, and really just in terms of how that fits into our strategic plan, that's definitely fits into making sure that we are addressing the needs of individuals, families, and communities. And again, using a data-driven approach to do that, looking at what the prevalence is of co-occurring disorders and ensuring that we're positioned to be able to address that. So definitely ongoing work, and we will continue to update all of you as we continue to make progress there. Okay, so the next question is integrated services a part of the OASAS priorities? Yes. So I definitely hear this. Again, long-winded answer to all the things that we're doing, and definitely part of the priorities. So another question, what does the strategic plan look like on the ground in the provision of services? Yeah, so I think that this is, what we are really working on right now. So we, this has been a long process, as I sort of talked about the timeline. We started this in 2022 and really have been very thoughtful and thinking about the pillars and the objectives and the goals. And in addition to that, we are really focusing at the agency level on what our priorities are in terms of where the field needs to be going and how those priorities fit into the strategic plan. So that is, ongoing work right now. And, just to give you examples of kind of how we might see this play out, is around looking for the need for methadone treatment, right? We know that fentanyl is in the drug supply at an extraordinarily high level, which we know that people have high opioid tolerance levels because of fentanyl. We know that methadone, which is a full opioid agonist, can address that high opioid tolerance really better than other medications that are out there. And we know that there are these regulatory changes that have happened at the federal level, which now allow us to really change the way that we provide methadone treatment. So to really meet the needs of communities, we're looking at parts of the state where there is no opioid treatment program and access to methadone treatment for at least an hour drive, right? Each way, to and from. That's a big barrier, right? And so we're looking again at the needs of the community and saying, what can we do to make sure that these communities have evidence-based services available? So part of that is transportation and thinking about, okay, we need to make sure that there's transportation available in these areas, that are the sort of OTP deserts, and we need to rethink the way that we're where we have our opioid treatment programs, and part of our strategy there is to think about integrating opioid treatment programs into outpatient programs, because we have a lot more coverage of outpatient programs in the state than we do for opioid treatment programs. So we're putting millions of dollars into transportation and integrating opioid treatment programs into outpatient programs, right? The sort of startup cost. So that's like one example of how, again, meeting the needs of communities is, we're taking that. Also, having a data-driven, evidence-based approach as well. And so that's sort of how this all comes together and how you might see this on the ground. Again, these are areas that we are actively working on right now, is really taking a critical look at what we're doing, how we're investing our time and resources and dollars, and how that fits or doesn't fit into the strategic plan. And if it doesn't fit into the strategic plan, then we have to ask ourselves, why are we doing this? So so that work is ongoing. Andrew, any comment in terms of that process?
No, I mean, obviously, I think you captured it, but it is, it's an iterative process. There's not like, we put this plan out, and it sits out there for 5 years, and sort of that's it, and no changes. I think, we as we respond to local needs and look at the needs of local communities through their local services plans or through our feedback, through the feedback we're receiving through this plan. It really is an active plan. And so the initiatives under it, will develop and change over time. And that's why if you read it, it's specific, but it's also a broad enough framework that it will allow us to sort of be responsive to things we learn as the process goes about.
Great. Thank you, Andrew. So next question, is OASAS considering alignment with the waiver and all the opportunities that it offers our work? So I think that's the 1115 waiver that you're referring to, and the answer to that is definitely yes. And so, I think there's still a lot of questions about exactly how the 1115 waiver, is going to be operationalized. Clearly, we're working with our sister agency, the Department of Health, in terms of thinking, about how that can really help support the work that's happening with all of you and in our system. I think, we don't know the answer to that yet. I think there's still a lot that still needs to be sort of figured out in terms of the details, but we do absolutely see how parts of this waiver can certainly are part of the strategic plan. So I think there's still some details to be determined, again, working with the Department of Health there, but certainly I think there are definite ways in which the waiver will help support the work that we're doing in meeting the needs of communities. So next comment, we would love to hear more input from the community about disparities and how people in supportive housing are treated by the providers that we fund. So, thank you for that comment. I have to say that, again, the central pillar is about the people that we serve, right? And one of the ways I think where we've really operationalized that is through our LEAP, which is our living experience advisory panel. And that's a new advisory panel that we created this year, specifically to hear from people who receive our services or people who have lived experience, and what their thoughts are about the variety of the services. So we've met a few times with them. We are continuing to meet with them, and so certainly housing is one of the topics that we do want to get feedback from them about. And I know you have here supportive housing, but I think another area that we're really interested is in recovery housing, because that's also brand new. And we know that we're going to need various iterations to get that quote unquote right, because that's a big undertaking. And so hearing again from providers, communities, people with lived experience about that process will also be really important. So definitely really important, and working with our lived experience advisory panel and housing is absolutely one of the topics that will be covered to get their advice and recommendations. Another comment or question, currently OASAS is approving 822 locations that are right next door to other operators. How is the planning of locations of providers going to be addressed in the plan? Yeah, so that's it. Thank you for that question. And that is certainly an ongoing discussion right now. And I think part of the internal strategic plan that we have is about our own processes, and certainly the regional office is part of that. And so how we do the sort of early engagement with providers and about citing of programs is certainly part of the discussion. So we've made some changes in terms of organizational structure and where the regional office is located. And part of, again, the strategic plan is reimagining some of the work that we're doing in the regional office to to make it more aligned with the community needs and make the processes more efficient. And certainly citing is part of the discussion. So so I don't have quote unquote the answer to this question, but this is part of the discussion. And really thinking about how we currently look at citing and really how the data about how many programs already exist in communities and then, you know, determining of whether there's really a need in those communities, that is part of our discussion now. And so thinking critically about that is part of what we're doing. So I definitely appreciate your comment. Are there any preliminary thoughts about how OASAS proposes to measure individual and program level outcomes across the continuum? That's an excellent question. And you know what? I'm going to hand that over to Andrew Heck.
Yeah, thank you. No, that's a great question. And as you probably noticed from that objective, it's, you know, the first thing is to establish those because, you know, we are really in that preliminary phase. But as part of that, I think the first thing we're doing is really talking to programs, you know, at different levels within the program, from this sort of CEO to the frontline worker, about what does good treatment look like, and to get an idea of you know, what those outcomes are, especially in a landscape in where the philosophy is definitely different than it was 5, 10, 15 years ago. So to get an idea of you know, at the program level, you know, what do programs think good treatment looks like, and then also combine that, you know, with research in terms of what we know, you know, positive outcomes are, how, you know, how we measure especially person-centered outcomes, and then also, besides measuring the outcomes, also to sort of look at those processes, which we know, again, in terms of evidence-based, where we know if certain processes are maintained, that will lead to good outcomes. So even if we can't measure the outcome itself, we can at least see well, you know, is the process in place that would lead to that outcome? And again, that, you know, looking at the evidence base there. So it's very preliminary, but it's for sure not a top-down effort in terms of OASAS dictating. It's about sort of this conversation of, you know, with the field of what good treatment looks like, and also you're consulting the literature and the data that we have access to sort of codify what's already known about that.
Thank you, Andrew. And you know, I just want to say that really this drives so much of what we want to do, right? I mean, the whole goal is so that people can live healthier lives, that they can get the best outcomes, right, that possible. And so understanding what those outcomes should be and then how we can achieve those outcomes, I mean, that's the whole point. And so I think this is the huge question that we're, you know, love to see here that you're asking, because we are actively working on this now. And you know, the world has changed, right? And I think we have to change with it in terms of what the kinds of measurements that we should be collecting, and that it's comprehensive and it's across different kinds of services. So this is something, you know, that I feel is extraordinarily important in helping guide us in terms of how we invest all of us, our time, our money, and our energy. Next is, could you please address the impact of removal of funding for vocational rehab services across the OASAS programs? Yes. So we are funding the programs, the vocational programs through the year. So we have met with all of the vocational programs and discussed this with them. We also, when we take a deeper dive at our vocational services, we realize that there's really an inequitable distribution of these resources across the state. Some of that is by geography, some of that is by program type, and we really want to rethink the model of how you know, vocational services should be provided to New Yorkers. We certainly know that these are important services, especially for people in recovery. And so we are working with providers to really rethink the model. So we have reached out. So we're in the process of doing this. Again, we've met with all of the vocational rehab providers. to have this discussion, and we are bringing people together to have a series of meetings to talk about rethinking the model so that it's a more equitably distributed model of services available to New Yorkers across the geography of the state and across our service continuum. So again, don't have the answer yet, but certainly working with the vocational rehab providers to really rethink that model. Next question is, with regard to professional credentials and addiction, are we seeking to have licensed professionals gain a specialty? For example, a psychiatric nurse practitioner with an addiction specialty, or a behavioral health physician assistant, or some other intent. So definitely appreciate this question. Workforce, huge issue. We know that. And frankly, the workforce in the field of addiction has been not invested in decades. So we're decades behind, and things obviously got worse with COVID, and now we are where we are. We're not going to fix this overnight, I can tell you that, right? Because this has been decades in the making. So right now, our focus is sort of twofold. One is support the existing workforce right now. So we know that people are exhausted and burnt out and stressed out, and we are really trying to, provide a variety of incentives for people to stay in the field. Some of that is money, but it's not all money, right? So we've had the bonuses, we've had the back-to-back cost of living adjustments. We're working on loan repayment right now. We have increased Medicaid rates for reimbursement. So really trying to help support the existing workforce. In addition, we know it's not just about money, but it's also about wellness and professional development. And so we have a leadership institute that we have invested in, and that is the planning and stuff is happening right now, but really to think about how we can help people develop their skill set to have career advancement in the field. And so that is also ongoing. So that's one piece. The second piece is to bring people into the field of addiction, and hopefully do that sooner rather than later. And so ways that we're doing that include, hopefully you've all seen all of the scholarships that are available. So scholarships for every part of the system, from KSACs to SERPAs to bachelor degrees to prevention specialists. And that is really, we can see the uptake has been already great, and it's only been 6 months thus far. Again, loan repayment is a big part of that as well. Paid internships is another part of that. We've heard from the programs that has been a really successful way of bringing new people into the field. We're supporting fellowship programs at medical schools that includes anywhere from medical students to social workers to nurses to nurse practitioners to physician assistants to physicians, and getting that specialized training in addiction. So many ways, because of course there's not one way, because if there were one way we would have figured it out already, but all these different ways to be able to support existing workforce and bring more people into the field of addiction. I think that the points here in the question about, like, shouldn't we have an addiction nurse practitioner? Shouldn't we have an addiction or behavioral health physician assistant? Yeah, I think so. And that's a really big question that is bigger than OASAS and bigger than New York State, but something that we have been discussing and working like nationally about how we can improve the workforce. Let me tell you, HRSA, right? Health Resources Services Administration. I have definitely provided feedback because they really are the federal agency that supports the workforce, about how we need more of these pathways. So I totally agree, 100%. Again, I'm going to say we're decades behind here. That to me is a much bigger, longer horizon, and really a much more of a national effort than just a state effort, but one that we're also advocating for at the federal level. So again, multiple different ways of trying to support the workforce, including advocating at the national level. Thank you, Janet, for your comments about it's exciting to have a forum. I'm glad you feel that way. I hope others feel that way. We really want to be transparent. We want to hear your ideas. We want to get your feedback. And so, through this and through our written survey, please, please, please provide feedback. Okay, another comment. Agency culture must embrace a sense of service for providers to help them treat the clients in their communities. Providers often feel that OASAS staff are capricious, punitive, and lack important knowledge about the challenges of providing services in our communities. I hear you. Thank you for that. And I think this also goes to the point that I sort of touched on earlier, which is rethinking our relationships. And this is definitely part of the strategic plan. Our reputation and our relationships and our outreach is speaking exactly to this. We, I want us to be more collaborative. This is a partnership, we want, when you succeed, we succeed, and New Yorkers succeed, right? And so it's a win-win-win across the board. And that's really the goal. And I know from a cultural standpoint, we may have a little bit of work to get there, and we are doing that work. We are, working with our regional office to really kind of reimagine what some of the, program visits and recertifications look like. And really with the goal of having it be less punitive, more collaborative, and more in the spirit of, we're all in this together. We want to help you to help the people that we serve. So appreciate your comment. So another comment about dual certification with OMH and OASS underway. I spoke to this a bunch about how we're working with OMH in a variety of ways, and part of that is around licensing and certification, and really for us thinking about what, instead of necessarily having to have dual certification, but what functions can we do within the existing regulations? And I think this is a discussion, we've had a lot of discussions around this with OMH, and I think in general, we and OMH feel that there's a lot more that programs can be doing under a single license, so that, if you have OASAS certification, there's a lot more of mental health services that can be provided under existing regulations than currently a lot of the programs are providing. So part of what we're doing is really trying to make that clearer and have more of a sort of clear pathway and also includes reimbursement differences about being able to provide different levels of co-occurring disorder treatment in both systems with a matching reimbursement rate for that. So more to come on this. Lot of discussions between OMH and OASAS, but really with the goal of just making it easier for programs to provide care to people who have both mental health and substance use conditions. So we're definitely working on it. So what is the role of prevention and prevention counseling in the strategic plan? So thank you for that question. I mean, I think that certainly part of what our goal was to do was to talk about services across the full continuum. And so we didn't, specify any part necessarily of the continuum, because we really think that the strategic plan is relevant to all parts of the continuum: prevention, treatment, harm reduction, and recovery. So, I'm not sure if part of this question is around billing or reimbursements. That's certainly part of discussions that we've had. But I think just in general, similar to the sort of description that I had with the opioid treatment programs and what, having deserts of opioid treatment programs across the state, we're doing the same thing for housing and recovery centers and prevention, the school-based prevention work and the community coalition. So we're doing this really across the entire system to say, where are we? Where are our services? Where are our services not located? Where are they part of the state that we need to really do a better job targeting? Or, or what communities are not necessarily getting these services? So we're doing that really across the board. And so prevention is absolutely included in that, as is treatment, harm reduction and recovery. So again, looking at what the needs are across the communities, looking at the data, looking at the service, how we are currently providing services, and really thinking more critically about how we should be providing those services to ensure that they match the needs of communities, that they're evidence-based, that they lead to positive outcomes, et cetera. Okay, this is a very specific question. Addressing the 2010 e-applications that HRA aren't processing correctly, nor the housing specialists, the therapists. These days don't know how to do psychosocial and psych evals according to protocol for housing, or a lot of issues administratively because administration and paperwork isn't thorough. So this is a question about HRA and housing. And, I think that this is a lot of detail that I certainly don't have this detailed information on hand, but what I do want to say that a lot of this, I think, is the overlap between OTDA and OASAS. And certainly we also, are working with them and really thinking about how we can improve services. I think certainly for housing, that's part of it. And then also knowing that there's issues around receiving benefits as well, other benefits. So, I think they also have new leadership there, a new commissioner. So these are issues that we are aware of and may not necessarily be under the OASAS authority, but certainly we're working with our partners across the state to address a lot of these decisions. So I want to just say that this is also part of the strategic plan, right? This is our goes into our reputation, relationships, and outreach. And part of those relationships are relationships not only with you all, providers, and the local government units, but the other state agencies where we know that people with addiction interact with, right? So housing and OTDA is one of that. Certainly docks, prisons, SCOC, jails, OMH, mental health, DOH, Medicaid, and primary care. I mean, so there's all these ways in which we're really working, thinking about how we work across, with external partners to OASAS, and how we can continue to really just be more strategic and focused on that work and be good collaborators. When is the feedback due by? August 31st. So you have a month and then we will close the surveys to provide that feedback on August 31st. Okay. Will there be another grant focusing on the SPF and working with college students again, similar to the 2018-2022 grant? So that's a very specific question about prevention that I just don't have the answer to at the top of my head. Again, I think, we're really looking at this at a 20,000 foot level in terms of what is needed, where services are, and making sure that we're targeting communities that, have the highest needs. And so I know that, working with college students is certainly part of that plan. I'm just not able to speak specifically about this one specific grant, but know that, this is absolutely part of the conversation around prevention services and, and thinking about how we're providing prevention services across the state. Okay. Peer workforce needs dedicated support for effective supervision. Yeah, and for continuing education and professional development. We agree totally. And again, these are part of the ongoing conversations around the workforce, around the career ladder for the workforce. And so we're actually right now even talking about, I've actually said this many times, is a lot of the scholarships that we're giving. We presented the data at the Opioid Settlement Fund Advisory Board, the first quarter of the scholarship data, and the majority of the scholarships are going to CASACs. If you want to look at the specific data, the slide set or the recording of that Opioid Settlement Fund Advisory Board meeting is on our webpage. And I think the meeting was like 2 weeks ago. Anyways, my point was that a lot of the scholarships are going to CASACs, and what we are seeing and feeling, and I'm sure many of you are as well, is really the incredible interest and need for peers really across the system. So, people want peers in emergency rooms, in courts, in jails, in prisons, in our treatment programs, and right. So we need to support the SERPAs more, and we need more scholarships. And so this is what I've been saying and working with our partners here to really enhance the scholarships for the SERPAs, because again, I don't think we have the workforce to meet the demand at all, particularly for the peers, and then certainly the supervision is part of it. So very much on the radar, very much having conversations around it. We have, existing scholarships. I don't think it's enough. We need to do more. And so we're in discussions about this now. Have we looked at decreasing certification hours or being more inclusive about the types of experiences candidates that can be approved? Yes. Yes. Again, these are all these conversations. I appreciate this. We have differences in language now. People, that's another big thing about being able to take some of the exams and with different languages. We're also having discussions around the hours and what counts and doesn't count. So I appreciate all these comments around the workforce. We are definitely in discussions about these, and really thinking about again, how we can support more people to come into the field and keep people in the field. Okay, interested to hear what is being done to become actively anti-racist. White supremacy is deeply rooted in capitalism, classism, misogyny, etc. To say we will be anti-racist or gender affirming is nice, but without working to dismantle barriers, we need to do that. Is having leaders appointed who are not representatives of the minority communities, positions of power. Okay, so how are we? Yeah, so how are we actively working to become anti-racist? So one of the first things that I did when I was commissioner is create a new office, the Office of JEDI, Justice, Equity, Diversity, and Inclusion, and to do this work. And it's not easy work, and it's not quick work, and it's hard work, and it's uncomfortable work. And our executive equity officer left the agency after about a year in that position. So some of that work has sort of been dispersed across the agency, and a little bit some of the work has been paused because of that vacancy. But we are actively looking for the next executive equity officer to lead this work. So what I would say, and we're working with an outside consulting company to help us with that. So it is work in progress. It's had a little bit of delays because of changes in leadership, but we are looking for to fill that vacancy and to continue on this work. So definitely appreciate the comment. Recognize it is not easy work. It is not short-term work, and it really needs to be part of everything that we do in the agency, and that is our plan. And so again, we're continuing with getting a new executive equity officer who is going to be leading a lot of that work. Next question, are there plans to engage and support BHCCs in achieving these objectives? Yes. So I think that, we're really thinking about how to work with the existing networks. BHUC is certainly part of that in thinking about how we can, better address the needs of communities, better address, equitable distribution of resources, thinking about the outcomes and measures. So absolutely all of it. And I think to Jeff, if there are other BHUC leadership that's not on here, making sure that everybody knows that they that we're looking for feedback, that would also be very helpful. Again, to encourage people to give written feedback here. But yeah, I mean, I think I know there's been some variability in how the BHCCs have operated across the state, but certainly we want to make sure that we're learning from those that have been really successful in their communities, and think about how the strategic plan can sort of leverage those lessons learned and those successes. So I'm just looking at the time. It's 10:56. And I know I'm not going to be able to get to everything that's in the chat. So, I apologize, but I just want to say, to everybody, please, 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 take this opportunity to give your feedback in writing on this survey. So let me just say one thing I haven't talked about yet is the criminal justice system. So will the strategic plan include any aspect of the criminal justice system to help treat clients? Yes, so we are working, so we know that so many people with addiction have involvement in the criminal justice system. We see that in our data. We know that from the stories. I personally know that from providing care for 22 years. Every one of my patients with addiction had been involved in the criminal justice system. So, and we know that this is a population who's extraordinarily high risk of overdose and dying. And so we are really working with our state partners, DOCS, who oversees prison and parole and probation, and then SCOC, who oversees jails, to really, and then we're also working with the court system as well, particularly the overdose intervention courts, to see how we can work together to improve the lives of people, who are involved in the criminal justice system. And so this is really a lot of work that we're doing, and I'm very proud of, ensuring every form of medication treatment in every jail and every prison across the state. That is not a small lift. We are the only state in the country doing it at this scale. And it will save lives 100%. There are some hiccups in some specific areas. We're working through them. But this is definitely part of the strategic plan. It definitely has to do with, equitable distribution of services. It definitely has to do with being anti-racist. It's an evidence-based, data-driven approach. It's meeting the needs of communities. So we see this in many parts of the strategic plan. Okay, so it's 10:59. So I'm sorry that I couldn't get to everything. Thank you so much, everybody, for joining us today, and for your comments and for your questions. Thank you, Andrew, Rick, and Lauren. Really, again, I'm just going to put in my last plug. Go to our website. When you close this out, it'll take you to the website. You'll have an opportunity to really take your time, look at the strategic plan. Please give us written feedback, and please share this with your colleagues. We really want to hear what you have to say. So thank you so much, everybody, for joining us today.